triceps reflex. And then relax. Next is the tricep reflex. Grasp the patient's wrist with your left hand and pull his arm across his chest so the elbow is flexed about 90 degrees and the forearm is partially bent down. Tap the triceps brachial tendon directly above the olecranon process. The normal response is the elbow extension. I'll be doing the brachialis reflex. I'll let the patient rest the forearm of the abdomen or lap. Strike the radius about 1 to 2 inches above the wrist. Watch for flexion or supination of the forearm. Next, I'll be doing the patellar reflex. I'll be striking the patellar tendon with the tendon hammer just below the patellar. And after that, the hammer and the leg normally extends once and comes to rest. I'll be doing the Achilles tendon reflex, which is tested by tapping the calcaneal tendon to elicit the plantar flexion at the ankle joint. Both is the adherent and the efferent leaves of the reflex arc are carried in the tibial nerve. Babinski reflex. To elicit the Babinski reflex, I'll be stroking the lateral aspect of the sole of the patient foot with a thumbnail or another moderate sharp object. Next, for the abdominal reflex, I'll be using a blunt object. Stroke the abdomen lightly on each side in inward and downward direction. Note the contraction of the abdominal muscles and deviation of the umbilicus towards the stimulus. Next is the cremasteric reflex. It's a superficial or close contact to skin surface reflex observed in human males. This reflex is elicited by lightly stroking the superior and medial part of thigh regardless of the direction of stroke. The normal response is immediate contraction to the cremas muscles and the pulse up the episteurial testis. This is the anal reflex. Assess the Koenig sign. The test is positive if there is generalized spinal pain, resistance to the test, or involuntary reflection of the opposite hips. A positive test indicates meningitis. Assess the Brunski's test. The test is positive if the patient involuntarily reflects their hips and knees in an attempt to lessen traction forces to the meninges.